Hello, this is Dr. Stanley Lang. Welcome to this broadcast, the topic of which is why lifestyle is superior to medication in treating type 2 diabetes. And the reason I wanted to share this thought today was because of two different patients that I saw who are not doing the lifestyle. They're both in the elderly age group for women who have been used to eating poorly for decades, and they represent a certain percentage of my practice that don't follow my program. The percentage that do follow the program generally get excellent results, and the reason that it's superior to do it with lifestyle versus medicine is because when you use medication to control diabetes and to push that blood sugar down without the lifestyle changes that reverse the underlying defect that is insulin resistance, then a lot of the metabolic problems that are part of diabetes keep going on, even if you have good blood sugars. And that metabolic process is loosely called insulin resistance syndrome. And so what happens with insulin resistance is that the high insulin levels are still present in people who are being controlled with medications to control their type 2 diabetes, because type 2 diabetes is an insulin resistant state. And that one of the major things that's going on is inflammation of the arteries, which is one of the major risk factors, the most important risk factor for calcification of the coronary arteries and therefore cardiac risk and heart attacks. So that's only one of 5 other things I could talk about that as a result of insulin resistance, but I just want to point out that even if you get control of your diabetes by normalizing your blood sugars with medicine, if you didn't change the lifestyle, you haven't fixed a big chunk of the problem, which is this insulin resistance, which is causing inflammation. So both of these patients I've spoken with for years about trying to change their diet, and they're pretty much not going to change because they like what they're doing and they accept the limitations of a relatively inactive lifestyle, being obese, not being able to do much. It's just part of what they accept. Now, to give you some insight, though, I came across an article today that I thought was, if it wasn't so representative of the problem of diabetes medical diabetes treatment, it would be humorous. But one of the points that I've made many times is that if you decide not to use lifestyle to reverse diabetes, diabetes worsens. It doesn't stand still. Insulin resistance worsens, and you have to keep adding medication. And most diabetic patients who are not using lifestyle to reverse diabetes are on 2 or 3 medicines just for their diabetes. So I came across this study, and it shows you how doctors are taught to look at success in diabetes. So in this is a study that was published in the Journal of Diabetes Investigation, and they were comparing, they're adding a second medicine to people that were already on a first medicine, and I won't name the two medicines, just to say that that was the study. And to qualify, these folks had to be not sufficiently controlled. And so so this study, I'll share what some of the outcomes for this study. So before they started the study, the A1C on average was 7.43. Now, we like to have the A1C less than 7 because that sort of correlates with when it's above 7, there's a sort of a more accelerated rate of complications. But anything above normal, there are complications. It's just that the rate of complications accelerates almost logarithmically once the A1C goes above 7. So we try to aim for less than 7. If you get less than 7, that's considered big success. So in this study, by adding this other medicine, at the end of a year, on average, the A1C had dropped from 7.43 to 6.93. Now that's a drop of less than 0.5 on average. And the thing that I want to point out here is that the rate of adverse effects, 86%, 86%, and the rate of adverse drug reactions, 21%. So this is accepted as okay, and this was a good outcome as far as these folks are concerned, because the end point was that they dropped that A1C a half a point, and at the end of the year. And so I'll just read the conclusion. The combination of these two medicines was confirmed to be tolerable. Now, I just read you the side effect complications that they had, and confirmed to provide long-term improvement in the A1C levels. This therapy should be considered as an effective treatment option for type 2 diabetes, etc. Now, the point is, they only dropped a point, a half of a A1C, half of a point. I have patients that have dropped their A1C 3 points in 6 months, easily following the program that we teach. If your goal is that you want to have control of your diabetes, or if you're pre-diabetic, you want to prevent progressing to diabetes, then the simple program that we use has been working for 30 years to help people with this problem. It's not rocket science. It's laid out very simply. So if you're looking for a path to run on, and you're confused by all of the variety of different things out there, this simple path will work for you, as it does for most people, if you just do it. So the alternative is this: you're going to be on the path of lots of medicines, poor control, and lots of complications, versus being able to reverse your diabetes or control it at least without medication, and have a minimal of medications. Because remember, if you're on medicines for diabetes, you're going to be on a medicine for your cholesterol, a statin drug, and likely on something for high blood pressure at the same time, maybe 2 things. So we're talking about 5 or 6 medicines for a lot of these diabetic patients, and that's a small number for some of them, versus not needing any medicine. And that's the alternative that you have, the Y in the road. You get to decide which way you want to go. You can be like these 2 patients that I described that have pretty much not made any progress for many, many years. They've got their usual list of excuses of why they're not making any progress, versus the patients who have seen the opportunity. They didn't want to be on all that medicine. They wanted to feel good. They wanted to have good energy levels. And so they made the changes. And you can too. So I wish you well. God bless, and have a great day.